Proximal hamstring tendinopathy presents as pain on the upper portion of the hamstring where the hamstring tendon attaches onto the pelvis. As a tendinopathy, it's generally considered as an overload condition where the forces that are placed on the hamstring tendon exceeds what it can tolerate, therefore causing pain. However, because of the anatomy of how the hamstring actually attaches onto the pelvis, it's also subject to a lot of compression, which can also irritate the tendon. And so any movement that causes hip flexion, so sitting, walking, running, sprinting, lunging, or squatting can all cause pain in the hamstring tendon. When most people think of the hamstring, they think of it as a knee flexor. However, the proximal portion of the hamstring actually works as a hip extender. So when we're looking at building a rehab program for proximal hamstring tendinopathy, we actually need to focus on hip extension rather than knee flexion. The rehab for a proximal hamstring tendinopathy generally follows a three-phase process. We'll have an isometric phase where we'll contract the muscle but we won't actually move the hip joint. We'll do a concentric and eccentric phase where we'll actually contract the hamstring through flexion and extension of the hip. And then we'll do a plyometric phase where we'll actually work on explosive power of the hamstring. For the isometric phase, there's two different exercises that we can do. We can do a long lever hold where it's a modification of the glute bridge where we're actually going to have our feet out as far as we can. And then we're going to lift our hips up off the ground and we'll hold this position for 30 to 45 seconds. The other isometric exercise is a standing hip extension where what we're going to do is we're going to have an exercise band wrapped around our ankles and then we're going to just extend our hip back, trying to maintain a nice neutral spine so that we're not actually extending through the low back and all the movement is actually coming from the hip. And again, we'll hold this position for 30 to 45 seconds. Generally, we'll use isometric exercises for a very irritated proximal hamstring tendinopathy. If we experience a lot of pain with movements, then we can start by loading the hamstring with these isometric exercises and then progress from there. There's some research that shows that isometric exercises, especially heavy isometric exercises, can have a pain relieving effect, although this hasn't been shown for other tendinopathies and specifically for proximal hamstring tendinopathy. The second phase is the concentric and eccentric muscle contraction, where we're actually going to flex and extend the hip. So we can start with actually just a modification of the long lever bridge that we use in the isometric contraction, except what we're going to do is we're going to elevate our feet on a bench or a chair, and then we're going to slowly lift our hips off of the ground and then slowly back down towards the ground. And we want to do this over a 3 to 4 second muscle contraction on each phase. Another exercise that we can do early on in the concentric and eccentric muscle contraction phase is a straight leg pull down. So we'll either use a cable machine or an exercise band attached to a door frame, and we'll lay on our back with the exercise band wrapped around our ankle, and then we're going to keep our knee relatively straight, and then we're going to slowly pull our foot down towards the ground, again over a 3 to 4 second muscle contraction, and then slowly come back up again over that 3 to 4 second muscle contraction. There are a bunch of other concentric-eccentric exercises for the hamstrings that we can continue to progress to so that we're increasing the loads that we're placing on the proximal hamstring. For example, we can do a straight leg pull-through where we'll have an exercise band or a cable machine behind us, and what we're going to do is we're going to push our hips back towards the anchor point and then extend back up, so that way we're working on hip extension. We can flip this around into a single leg variation where we'll do a single leg pull. And so we'll bring our chest down towards the ground and then bring our torso back to vertical so that we're working on hip extension on that stance leg in a single leg position. And then we can progress to deadlifts, both double leg and single leg variations, so that we're continuing to increase the load that we're placing on that proximal hamstring. And the final phase is the plyometric phase, where we're going to work on quick hamstring contractions specifically into hip extension. And this is important specifically for returning to sport, because in sport we're going to be experiencing these high loads placed on the proximal hamstring, specifically with running, sprinting, and jumping. So we want to make sure that the hamstring tendon is able to tolerate those high loads. Exercises that we can do in this phase include skipping, squat jumps, and jumping lunges. For skipping, we'll work on two different things. We'll work on hip drive. So in one of our legs, we're going to drive our knee up towards our chest. For the other leg, we're going to work on hip extension. So we're going to work on exploding up into the air, getting full extension in the other hip. For squat jumps, we might initially start with a small amount of hip flexion, so it'll look more like a hop initially, and then we can progress to a deeper squat so that we're actually loading the hamstring from a flexed position all the way to an extended position. For the jumping lunge, we might follow the same advice as we did for the jumping squat, where we'll start with less hip flexion and then gradually progress to more of a lunge position. And so initially you might have just a little bit of hip flexion and then jump and switch our feet. And then as we progress, go deeper into that lunge and do the same thing. The benefit of the jumping lunge compared to the jumping squat is that it'll actually load a little bit more of a single leg versus a jumping squat, which is a double leg movement.